This is the Invite Health Podcast, and I am Amanda Williams. On today's episode, I am going to be discussing chronic disease states and the risk for coronavirus. This is something that we've all been hearing about. Those who have chronic diseases or underlying medical conditions that may be impacting your immune system can put you at a greater risk for, if you do contract COVID-19, the symptoms becoming much more severe and significantly impacting your health in a very negative way. So we're going to talk about that because we know when it comes to chronic disease states, many Americans fall into this category. And I've been getting an awful lot of questions via email and people calling that are concerned about this. And I certainly see the reason as to why people would be concerned. So before we get started, just remember to subscribe to the Invite Health Podcast today. You can leave us a review. You can also follow us on Facebook, Twitter, and Instagram at Invite Health. All of the information on today's episode will be linked in the episode description, and you can visit invitehealth.com/podcast for more information. So my background, I have a medical doctorate. I'm not practicing clinical medicine, but I do have a medical doctorate, and I also have a master's degree in public health. So in my public health background, in the education that I gained from having a master's degree in public health, one of the areas that you look at is disease outbreaks, and you look at epidemiology, and you look at the biostatistics and how different health events are affecting particular communities. So when they talk about community spread of a virus, of this infection spreading at a rapid rate, and especially impacting those who are most vulnerable, you have to include into that people who have underlying health conditions. We know this. This is why they always say the healthier you are, the better off you are, right? But even healthy people, we know, we're seeing this, we're witnessing this. We can see that people who even have strong immune systems can still be carrying this virus and still experience mild to moderate symptoms. But when we think about the wide range of people in the United States that have conditions such as high blood pressure, such as diabetes, such as prediabetes, heart disease, that can lower your immune system. And then you can throw into the mix people who have autoimmune conditions and people who are on medications that may be altering your immune defenses, certain medications that may be lowering key vitamins in your body, such as vitamin D. And we know vitamin D is incredibly important when it comes to your immune system. So this is an area that I want people to really understand, that if you've been diagnosed with high blood pressure, hypertension, if you've been diagnosed with something such as diabetes, that you need to be taking the appropriate steps right now. One of the areas that I find really interesting that they oftentimes do not discuss is maintaining your health in spite of a disease. Many times they just label something and say, okay, you have high blood pressure or you have diabetes, which puts you at a greater risk, without putting the disclaimer out there that if you are managing your health, even in spite of a disease, your immune system may still be able to fend these things off. Now, there is a huge difference between disease state management, and this is something that I've worked with extensively when it comes to diabetics. So I did a specialized training that is designed through Stanford University for diabetics in disease state management. So if you can manage your disease, you lower your risk for potential complications, including things such as viral infections, bacterial infections. We know these things. But unfortunately right now, because people are kind of losing it a little bit, and it's understandable. I understand that people have fear. I understand that people are concerned about their friends, their family members, their coworkers. I understand that. But the more information that you have in order to gain you better support to manage your health, even if you do have a chronic disease, is going to give you much more peace of mind. And right now, peace of mind does so much for your immune system. If you are continuously stressing out, this actually is going to lower your immunity. Cortisol can really be our enemy. So if your stress hormone is driving up every single day, this is actually going to push down and damper your immune response. So I'm going to talk about what you can be doing to manage your disease states, at the same time helping to support and enhance your immune defenses. But we're going to take a quick break, so we'll be right back.
This podcast is brought to you by InviteHealth.com. For over 20 years, Invite Health has provided premium quality supplements and expert advice you can trust. Now, first-time customers can enjoy an exclusive offer. Visit invitehealth.com/podcast or click the link in this episode description. That's invitehealth.com/podcast for your exclusive offer on Invite Health products. Invite Health offers the resources you need to make important decisions about your health. Chat live with degreed healthcare professionals, get product information, and find retail locations near you at invitehealth.com. You can also learn about our new genetic testing program and our exclusive Invite Fitness Wellness program. Follow Invite Health on Facebook, Twitter, and Instagram, and be sure to subscribe to our podcast today. Now back to our episode.
And welcome back. So now let's talk about this, because we keep hearing it. You turn on the news, they say people who have, underlying health conditions are at a greater risk. And certainly we know this to be the case. There's different reasons. People can have underlying autoimmune conditions. You can be fighting off certain infections as it is right now. You may have heart disease, hypertension, diabetes. But the one area that we don't focus enough on is managing your disease state. If you manage your high blood pressure, and if you're managing your blood sugar, then your immune system is going to be happier. If your blood pressure is running amok and your blood sugar is running amok, then of course you're going to lower your immunity. So this is why right now, trying to incorporate healthy foods, and I understand getting access to foods right now is a little bit difficult, but there are still ways that you can try and bolster up your immune defenses. Utilizing products that provide you with those wonderful antioxidants, things like Reds HX or Greens HX. These are really nice ways for you to still gain those benefits from fruits and vegetables that you may not have direct access to right now. But adhering to a Mediterranean diet to keep your body in a low state of inflammation is certainly critical. So if people can manage their disease states on a regular basis, not even in spite of COVID-19 right now, but say on a regular basis, if you can manage your diabetes or your pre-diabetes because you're doing the right things with your diet, you're eating good, healthy, high antioxidant, packed with nutrient foods that have a good amount of fiber in them to offset all of the negative effects of having insulin resistance, then you will find that your immune system is going to respond in kind. So when you look at different markers for inflammation to check and assess the state of hyperinflammation going on in the body, we can already see that when people adhere to a healthier diet, those markers for inflammation begin to come down. So the key right now is managing your disease states. Not to go all willy-nilly and just say, oh my goodness, I have to just eat whatever I have to eat and just forget everything else. No, you want to still try and get good, healthy nutrients in. You want to try and have, fresh fruits, green leafy vegetables, healthy seeds and nuts right now. And remember, being that we already understand that access to food is a bit more difficult right now, we have really wonderful things such as the Reds HX and the Greens HX that are packed with healthy probiotics to boost up that immune system, with wonderful fruit and vegetable extracts to give your body those key and essential antioxidants to be able to fend off oxidative stress. So managing your disease state has never been more important. And you do it on two different fronts. Number one is by choosing healthy foods. Number two is by supplementing with areas you're lacking right now. So looking at things like probiotic, vitamin C, vitamin D, these are all things that can really help your immune system at this point in time. And managing stress. This plays a huge part of this. For those who have underlying conditions such as diabetes and heart disease, if your body is stressed, you're going to have a real hard time managing those conditions. So looking at ways to decompress your body will allow your immune system to stay at a heightened state of readiness. So things such as green tea and L-theanine can give a significant amount of support when it comes to managing cortisol. Maybe you're feeling like you're kind of dragging right now because you just don't know what to do. So then you can look at adrenal adaptogenic herbs such as rhodiola that can be very advantageous right now to help your body when it comes to modulating that stress response. So these are all key things that you want to be considering. Because when we turn on the news and we hear, oh goodness, if I have high blood pressure, if I have diabetes, I'm doomed. And we want to make sure that you're doing the right things to have your immune system at that ready state. And there are ways that you can do that. So stress, you have to be able to react properly to the stress. We have to make sure we're getting the right nutrients, the right vitamins, the right minerals. So managing your disease state can be achieved if we're doing the right things in terms of dietary intake. So we understand that right now, people are very stressed and people are very worried. But the best thing that you can be doing for your immune system is feeding your body the healthiest foods that you can possibly obtain right now. Now is not the time to say, okay, it's hard to get food, so I'm just going to, eat whatever junk food I can come across. This doesn't help your immune system, and especially if you have underlying health conditions. This time is more important than ever for you to make sure that you're avoiding things like high sugary foods and high sugary drinks. You should be doing things such as green tea to bolster the immune system, as opposed to drinking a soda throughout the day. These are the things that you can do when you're dealing with this crisis and when you're dealing with underlying chronic disease states. We have to manage the inflammation. That's what it comes down to. The more we manage the inflammation, the better our immune system will do. So this is just a quick little overview for those of you who are out there that have those concerns. Remember, we are here to help you help yourselves. And when you have questions, certainly make sure that you reach out to us. We are here during this time for you. Now, just to wrap things up for you, do remember to tune in to all of our Invite Health podcasts. Every single day we have a new podcast that's coming out to keep you well informed. Remember, you can find all of our podcasts wherever you listen to podcasts or by visiting invitehealth.com/podcast. Make sure you subscribe, leave us a review, follow us on Facebook, Twitter, and Instagram at invitehealth.com. And we will see you next time for another episode of Invite Health Podcast.